Chief of Emergency Services Gerald Marsh wanted to make an example of the quietest nurse on the floor. He did it in front of residents, charge nurses, and 2 administrative cameras that blinked red above the intake desk. He handed her 4 critical patients and walked away smiling. He thought he was proving a point about chain of command. What he proved instead, in less than 2 hours on the worst night of that February, was something nobody at Harbour Cross had ever expected from a woman who kept her head down and her badge turned inward. Before I tell you the rest, welcome to Steady Badge's Stories. If you believe the quietest person in the room is sometimes the most dangerous one to underestimate, hit like, subscribe, and tell me in the comments where you're listening from tonight. Because this story is going to stay with you. The storm hit Harbour Cross, Nova Scotia, the way February storms along that coast always did, without apology and without warning, the civilian weather network having already been wrong twice that week. By 6 in the evening, Highway 104 had collected enough black ice to close 2 lanes and crush the front end of a transport truck into a guardrail. The truck had been carrying materials, not people. The cars behind it had been carrying both. Claire Donovan heard the radio chatter before dispatch finished the sentence. 4 vehicles, possible entrapment. ETA on first ambulance, 11 minutes. She was already pulling on a second pair of gloves. The ER at Harbour Cross wasn't large. 16 days on a good night, 10 staffed on a Tuesday in February when 3 nurses had called in sick, and the on-call supervisor had decided that manageable was the right word for the situation. The charge desk sat at the center like a nerve, and around it moved the people who kept the hospital breathing. Dr. Kevin Lau, the senior emergency physician that night, quiet and methodical in the way of someone who had seen enough to stop performing for an audience. Tara, a third-year resident who moved fast and apologized too much. Marcus, an ER tech who had worked that floor for 6 years and knew where every supply lived without looking. And Claire. Claire Donovan was 38. She had brown hair pulled back tight, and a scrubs topped the shade of a clear sky that somehow always looked 1 shade too cheerful for the things she had to do while wearing it. Her badge said RN. She had worked at Harbour Cross for 14 months. In that time, she had received 2 written commendations and 1 formal complaint, the complaint filed by Gerald Marsh, Chief of Emergency Services, for what he had described in writing as insubordinate deviation from triage protocol. What she had actually done was re-triage a septic patient Marsh had categorized as non-urgent. The patient had survived. Marsh had not mentioned that part in the complaint. Marsh was at the charge desk when the radio updated to 6 patients. He was not supposed to be in the ER that evening. He had come down, he said, for an administrative review. But that didn't explain why he was standing with his arms crossed, watching the board, wearing the particular expression of a man waiting for someone to fail. He found Claire at the medication cart. "Donovan," he said. She looked up. "With Lau running the trauma bay and Reed occupied upstairs, you're the senior nurse on this floor." He said it the way people say things they don't actually mean as compliments. 4 incoming, multi-vehicle. "You want to talk about staffing?" "I've already asked Marcus to prep 4 bays," she said. "I wasn't asking about Marcus." She waited. Marsh smiled. It didn't reach his eyes. "I want to see your triage instincts, Donovan. You've made it very clear in your safety filings that you think you understand this department better than it's being run." He spread one hand toward the ambulance bay doors. "So, lead it." Dr. Lau had come to the edge of the bay. "Gerald, we have 12 minutes. "And Donovan has 12 minutes. Marsh stepped back. "Let's see the brilliance." A silence followed that wasn't empty. It was loaded, the way a room gets when everyone understands something ugly has just been made official. Claire set down the chart she was holding. She did not look at Marsh again. "Bay 1 gets the driver of the transport," she said, moving toward the board. "Bay 2 gets any pediatric. Bay 3 gets crush injury. Bay 4 gets respiratory compromise from impact." She turned to Marcus. "Pull the thoracic tray and the pediatric crash cart. I want them pre-positioned, not in storage." Marcus was already moving. "You haven't seen the patients yet," Marsh said. "No," Claire said, "but I've seen the road." Tara looked at Dr. Lau. Lau looked at Claire with an expression that might have been the beginning of something he hadn't felt in a while. The ambulance bay doors opened at 6:47 p.m. and the night became something else entirely. The first stretcher came through fast, paramedics talking over each other in that controlled shorthand Claire had learned to read like a second language. Male, mid-50s. Arthur Benoit, driver of a sedan that had spun into the guardrail at highway speed. His left arm was wrong in a way that suggested multiple fractures. His breathing was wrong in a different way. Shallow right side, the kind of asymmetry that could mean a pneumothorax building pressure behind the lung. "Bay 3, Claire said, overriding her own earlier assignment without hesitation. "He's not a crush injury, he's a chest. Needle chest kit, right side." "Right," the paramedic confirmed. The second stretcher was a woman, 40s, coherent enough to be terrified, which Claire clocked as a good sign and moved past. The third stretcher made the room shift. It was a child, a girl, 7 or 8, dark braids, a broken wrist already splinted by the paramedics, her face gone the color of old chalk, not screaming. Children who weren't screaming after a highway impact were the ones who needed the most immediate attention. Because silence in a hurt child wasn't calm. It was the body conserving everything it had left. "What's her name?" "Zoe," the second paramedic said. "Mom's in the 4th unit. Zoe was in the back seat." "Bay 2. Claire touched the girl's hand. "Hey, I'm Claire. I'm going to stay close, okay?" Zoe's eyes tracked toward her. That was enough. The 4th stretcher was Zoe's mother, Renee, whose name Claire read off an ID bag on the stretcher bar. Renee was unconscious, blood pressure dropping, abdomen rigid, the kind of presentation that needed a surgeon, needed blood, needed things this could provide some of, and was running short on others. Marsh appeared at the edge of Bay 4. "Where's the attending?" "Lau is in Bay 3, Claire said, not looking up. "I need warm blood products for Bay 4 before her pressure drops another 10 points. You need to wait for the physician's order." Claire looked up, just once. "She has internal bleeding, Director. The physician is 60 feet away securing an airway on a man who'll die in 4 minutes without him. Do you want me to interrupt that, or do you want me to hang blood?" Marsh's jaw tightened. "I will note this deviation." "Note it after," Claire said. "Tara." Blood warmed. "She's already losing temperature from the impact." Tara moved, and something in the way she moved said she had made a decision. That evening she hadn't been sure she could make before. Arthur Benoit stabilized first. Lau found the tension pneumothorax in under 2 minutes. Claire's needle decompression already buying him relief. The kind of intervention that sat in a professional gray zone Marsh would almost certainly raise in the morning, and that Claire had already decided not to think about, until Arthur Benoit was alive enough to be angry about it. He was. The monitor steadied. Lau exhaled once quietly, and looked at Claire over the patient. "Where did you learn that approach?" Not accusatory, genuinely curious. "Experience," she said. "With pneumothorax?" "With not having time to wait." He held her gaze a second, then Bay 4. They moved. Renee's abdomen was the problem without a fast solution. And the problem without a fast solution was the one that killed people while you were busy managing the ones that did. Marcus appeared at Claire's shoulder. "Ultrasound has enough battery. Portable." "Give it to me." Marsh stepped into the doorway. "Ultrasound requires." "Physician supervision, yes," Lau said, stepping in behind him. "I'm supervising. Go." The probe found what Claire had suspected. Free fluid in the abdomen, enough that surgery wasn't a question but a timeline. The question was whether that timeline ran in minutes or something shorter. "She needs the ore," Claire said. "Surgery's on call from home. 20-minute response," Marsh said. "She has 12. "You can't know that." "I can estimate it from the rate of accumulation, her pressure trajectory, and the fact that she's a mother whose daughter is in Bay 2 asking for her." Claire never raised her voice. "Get surgery on the phone and tell them 10 minutes, not 20. You do not give orders in my department." Dr. Lau turned to Marsh fully, his voice very quiet. "Gerald, get out of this bay." The silence after that was the kind that meant something had permanently shifted. Bay 2 was where Claire allowed herself, for exactly 40 seconds, to be afraid. Zoe Tremblay lay under a warming blanket, her splinted arm at her side, her eyes half open in the unfocused way that could mean concussion, could mean blood pressure, could mean something worse the first scan hadn't caught. Her color had gone one shade wrong in 8 minutes. Her heart rate was working too hard to hold a number it should have held without effort. Marcus was beside her, his expression doing the thing experienced Tex's faces did, when they'd noticed something they were hoping they were wrong about. "She's been quiet," he said, "since they brought her in." Claire put her hand on Zoe's sternum, felt the effort of her breathing, noted the slightly distended abdomen, internal, a different origin than her mother's. Pediatric trauma had its own geometry, its own hiding places. Children's abdomens were more elastic, which meant they could conceal a developing bleed longer than an adult's before looking anything but stable. "Zoo, can you squeeze my hand?" A small pressure, faint but present. "Good girl." She looked at Marcus. "She needs blood and imaging, in the order that keeps her pressure from dropping before we know where the bleed is." She went to the door. "Tara, pediatric blood products. Cross-matches already in the system. Get the order from Lau." "He's on the phone with surgery," Tara said. "Then I need him off that phone in 45 seconds. Marsh reappeared the way he always did, as if his presence alone could change the outcome of a room. "Donovan, you are operating outside your scope on every bay in this department right now." She looked at him, not angry, something more precise than angry. "Director Marsh." There is a 7-year-old in this bay whose mother is in surgery in 40 minutes if we do our jobs tonight. She has a developing abdominal bleed I caught early enough that we can do something about it. Her name is Zoe. She meant every word of it. That is the only thing that exists right now. From Bay 3, Arthur Benoit's monitor alarmed. Not critically, a rate change that needed a check, not a crash, but it was enough. Marsh went toward it, because that was what administrators did when they wanted to look useful. Claire went back to Zoe. The storm took out a circuit breaker at 7:31 p.m. Not a full outage, emergency power caught most of it, but it left Bay 4 in 40 seconds of darkness, the portable ultrasound cycling back from a dead restart, and a surgical team that had just arrived after a 26-minute drive on closed roads standing in a hallway asking who was running this situation. The surgeon was Dr. Elise Fontaine, a woman who didn't waste energy on pleasantries during active events and expected the same from whoever briefed her. "Claire," Dr. Lau said. Fontaine looked at Claire, who gave her the report in under a minute. Bay 3, tension pneumothorax decompressed stable, needs CT when weather permits transfer. Bay 4, blunt abdominal trauma, free fluid declining pressure, exploratory lap candidate, your patient. Bay 2, pediatric, 7, suspected splenic injury, currently maintaining but window closing. Bay 1, multiple fractures, hemodynamically stable, lowest priority. Fontaine looked at her the way people looked at someone when the information was correct and the delivery unfamiliar. "Who prepared this patient?" "I assessed her." "What's your background?" The question landed differently than it should have, because the room was listening by then. Tara, Marcus, Dr. Lau, all gone still. Marsh answered before Claire could. He had come back, he had a way of always coming back. "She's an RN, Dr. Fontaine. Floor nurse, night shift." "That's not what I asked," Fontaine said, looking at Claire. "I'm the nurse who told you about your patient," Claire said. "You should go see her." Fontaine held her gaze one more second, nodded once, and moved toward Bay 4. Marsh stepped into Claire's line of sight. "I want an answer to that question too." "You have my file," Claire said, and turned back to Zoe. It was Arthur Benoit who noticed first, because 40 years of long haul, driving through Atlantic winters, had taught him that the difference between surviving a bad situation and not surviving it was almost always the person who stayed calm while everyone else chose a direction. He watched Claire move between bays. He watched her check the child, check her again, adjust the warming blanket with the efficiency of someone who'd done this in places without warming blankets. He watched her turn her back on Marsh every time the man appeared, not rudeness, but the clearest message she had that she wouldn't let his presence occupy space she needed for something else. When Marcus checked his vitals, Arthur said, "She was military." Marcus didn't look up from the cuff. "What makes you say that?" "I've seen a lot of people under pressure. Most get loud, or they get small. She got smaller on the outside and bigger on the inside." He paused. "Only people I've seen do that were the ones who'd been trained for it." Marcus wrote down the number and moved on, but he didn't forget it. Zoe's pressure dropped at 7:58 p.m., not catastrophically, enough. Claire was in the bay in under 15 seconds, because she had not, despite what it looked like, stopped watching that monitor for the past 22 minutes. "Lau's with Fontaine," Tara started. "I know." Claire checked Zoe's abdomen, her eyes, her color, moving through the assessment with the speed of someone skipping steps that were redundant once the conclusion was visible. "She's bleeding faster than we can replace. She needs to go upstairs." "Fontaine's in surgery." "There are 2 ORs in this hospital. Who's the second on-call surgeon tonight?" Tara checked the board. Dr. Renfrew, not on site. "How far?" 15 minutes, maybe 20 in the storm. Claire looked at the small hand, with chipped purple nail polish resting near the edge of the warming blanket, at the chest, still doing the work it needed to do, but working harder than an 8-year-old should have to. She made the call herself from the desk phone, while Marsh stood 5 feet away and watched. 40 seconds of clinical information to Renfrew. He said he was leaving now. She said drive carefully. She meant it. "You called a surgeon without physician authorization," Marsh said. "Dr. Lau authorized it." "Lau is in the OR." "He authorized it before he went in. You can verify it on the call log." She had in fact messaged him from the floor tablet and gotten a 2-character reply. Go 40 seconds before she picked up the phone. She'd known what his answer would be. She'd asked anyway. Because she understood the difference between knowing the right answer and documenting that the process had been followed. Marsh stared at her. Something shifted in his face. Not anger exactly, but the discomfort of a man who keeps looking for an edge to hold and find someone has already sanded it down. Dr. Renfrew arrived in 18 minutes, shaking snow off his jacket, already talking. Marcus met him at the door with the chart. Tara met him at the bay with vitals. Claire met him at Zoe's side with everything that mattered. Splenic laceration, grade 2 at minimum, possibly 3. On blood products 20 minutes, pressure holding but declining gradient. She's awake, tracking, asked for her mom 11 minutes ago. I told her the truth, her mom's being taken care of by another doctor upstairs. Hey sweetheart, I'm Dr. Renfrew, I'm going to take care of you, okay? Zoe looked at him, then at Claire. Are you coming? Claire took her hand briefly. I'm going to stay here and make sure everyone else is okay, but Dr. Renfrew is very good at his job. Not reassurance for its own sake, reassurance because it happened to be true. Zoe went to the OR at 8:24 p.m. The ear settled into the particular rhythm of a department that has been through something. Not quiet, but purposeful. Marcus restocked trays. Tara updated charts with the care of someone who'd realized documentation wasn't paperwork, it was the record of what you did and why and for whom. Arthur Benoit slept in Bay 3, which was the best thing he could be doing. Marsh stood at the charge desk for a long time, in clear view of the camera that had a fixed angle on the desk, the center of the floor, and the door to the hallway beyond. 2 people came through that door at 8:47 p.m., dressed in civilian clothes that didn't quite sit the way civilian clothes should, reading the ER with the assessment of people trained to walk into a space and immediately understand its variables. The taller one had gray in his hair and a posture that didn't belong to anyone who'd spent a career at a desk. The younger carried a sealed folder and was already looking past Marsh toward the center of the floor. They looked at Claire. Claire looked at them. Something crossed her face the ER hadn't seen all night. Not fear, not quite warmth. Recognition, the complicated kind. The taller man stopped a few feet from her. Warrant Officer Donovan. The room went still. Dr. Lau had come out of the OR hallway, gloves off, his expression careful and unreadable. Marsh turned to the men. This is a restricted area. Major Callum Voss, Canadian Forces, we need a moment. She's a floor nurse, Marsh said. The younger man opened the folder. She is also Warrant Officer First Class Claire Donovan, formerly of 435 Transport and Rescue Squadron, Canadian Armed Forces Search and Rescue, call sign REN, 6 years active, 2 deployments supporting NATO medical operations in Latvia and Mali. Advanced Trauma Life Support, Military Emergency Medical Technician, CSAR certification, 2 commendations for field medicine under sustained adverse conditions. SARTech, Marcus murmured. What's that? Tara asked. Canadian version of Parazescu, Marcus said quietly. They go in when everyone else can't. Marsh had gone very still, a different stillness than Claire's. Hers came from having nothing to hide, his came from calculating too many things at once. Why are you here? Claire asked Voss. Her voice hadn't changed. It never did whether she was hanging blood or facing an officer in the middle of a civilian ER. Your name came up in a federal safety review. This hospital has had 3 preventable patient deaths in the past 8 months. Anonymous safety reports filed with the Provincial Health Authority flagged a pattern in delayed triage, cancelled consults, and missing mortality reviews. He paused. The language in those reports matched CSAR after action documentation format. Marsh's head turned toward Claire. She didn't look at him. One of those deaths, Voss continued, was a 44-year-old father of 2 who waited 93 minutes for a cardiac consult cancelled by the Emergency Services Director for administrative reasons. His name was Bernard Gelinas. His daughter called her MP's office. The ER was silent. Even the monitors seemed quieter. Lau shut his eyes for a moment. Those reviews were conducted internally and closed, Marsh said. By your own risk management office. By qualified professionals. Who report to you? Voss said, flat, unsurprised by what the file had told him. Director Marsh, your conduct tonight has been recorded and will be included in the provincial and federal review. Marsh's gaze went to the blinking red light above the charge desk. He straightened his jacket. Whatever her background, Nurse Donovan performed multiple procedures beyond nursing scope tonight. Every action she took is subject to review for unauthorized practice. Claire pulled off her gloves and dropped them in the waste bin, a small final sound. Review all of it, she said. Review the needle decompression I performed because the surgeon was 26 minutes away, and Arthur Benoit had 4 minutes of margin. Review the blood products I ordered for Renee Tremblay because her pressure was declining faster than the authorization chain could keep up with. Review the call I placed to Dr. Renfrew because a 7-year-old girl needed a surgeon and the one on site was already saving her mother. She looked around the room. Tara, Marcus, Lau, the camera. Review every second. That's what it's for. You deceived this hospital, Marsh said. No. I accepted a nursing position. I used the skills I had. I didn't advertise my background because it wasn't the point. She looked at him, finished with the subject. You made it the point tonight when you used it as a weapon. That's yours to account for. Voss stepped forward, ran all 4 patients. She turned to the board. Arthur Benoit, Bay 3. Stable chest decompression holding, monitoring for reaccumulation. Renee Tremblay, in surgery with Dr. Fontaine, prognosis guarded but viable. Zoe Tremblay in surgery with Dr. Renfrew. She asked for her mother before she went up. I told her the truth. Bay 1, Harold Fitzgerald, multiple upper extremity fractures, hemodynamically stable, waiting on an ortho consult in the morning. 4 for 4, Voss said. Not out of the woods, Claire said, but alive enough to fight the rest of it themselves. Administrators arrived at 9. Not Marsh's, but board members and 2 officials from the Provincial Health Authority, who'd driven from Halifax through the storm. Behind them came a compliance officer named Danielle, who had the look of someone finally given permission to put certain documentation on the table. Over the next hour, she put a great deal on it. Cancelled consults, reclassified triage categories, mortality reviews signed off without independent verification, and a memo dated 3 weeks after Claire had started at Harbour Cross, directing staff to route all safety concerns through the director's office before external filing. Marsh called it policy. Danielle called it suppression. The board member from Halifax asked how many reports had been intercepted. We're counting, Danielle said. Marsh tried at one point to reach the server room. 2 of Voss's people were already there. A hospital security guard, to his visible surprise, did not step aside. Tara found Claire in the hallway outside Bay 2 at 10:15. The bay was empty, the warming blanket folded on a chair, the monitor reset, a smear of purple nail polish on the bed rail, the only sign Zoe had been there. Claire stood in the corridor, arms at her sides, not doing anything, just standing. Renfrew called down, Tara said. Zoe's out. They got the bleed. She's in recovery, asking for her mom. Claire exhaled, one slow breath, the kind that follows sustained attention with no good release valve. Renee? Still with Fontaine. Last update was stable. 40 more minutes. Claire nodded. You filed those reports, Tara said, not a question, about Bernard Gelinas. And 2 others. There would have been more. I saw his case on the board when I started. Documentation said no deviation from standard care. I know what it said. You'd only been here 6 weeks. Long enough to know what standard care looked like, Claire said, and what it didn't. At midnight, Marsh sat through a 47-minute conversation with 2 provincial investigators and a board member. The details never became public. The outcome, suspension pending investigation, effective immediately, was confirmed by internal memo at 12:53 a.m. Someone quietly removed his name from the department directory board before 1 o'clock. Nobody mentioned it. Dr. Lau found Claire at the charge desk at midnight, jacket already on, though he hadn't left. I owe you an apology, he said. I knew the safety reports were being suppressed. I didn't know how, and I didn't push hard enough to find out. I kept telling myself it was above my pay grade and below my authority. He looked at the board, at the 4 names still on it. It wasn't. No, Claire said. You could have said something, to me, to any of us. I did. 14 times, in writing, to the provincial authority. I said it the way that doesn't get intercepted at the director's office. He was quiet a moment. What matters now is what you do with what you know. I'm going to need you in this department long term, he said. Not just tonight. I'm already here. I've been here 14 months. He almost smiled, small, tired, genuine. I'm aware. He shrugged into his jacket. Renfrew says Zoe's prognosis is good. Fontaine's cautiously optimistic on Renee. I'll be back by 7. Get some sleep. Actual sleep. You're no good to anyone on 4 hours. Is that clinical advice? It's 14 months of watching you function. He left. Major Voss stayed until 2 in the morning, standing near the desk without saying much. He had always understood that some conversations needed the weather to settle before they could happen. You could have stayed in, he said eventually. I know. We would have found a role. I know that too. He looked over the ER's late-hour rhythm, a chest pain in Bay 3, a fall from ice in Bay 6, a teenager with a dislocated shoulder being very stoic in front of a resident he was clearly trying to impress. Ordinary things, the kind hospitals were full of when nobody was intervening to make them otherwise. Why here? Voss asked. She thought about it, not because she didn't know the answer, but because the honest version took a moment. Because I got tired of going in after, she said. Extraction, recovery, the end of the bad thing. She looked at the board. Here, sometimes you can stop the bad thing before it's finished happening. Sometimes. Bernard Gelinas, Voss said. Not that time, not soon enough. That's why the reports. That's why the reports. He set his card on the desk beside her. The review will take months. You'll be called in. Asked about your qualifications, your scope of practice, every decision you made tonight. I know. And? She picked up a chart, and I'll tell them exactly what I did and why. Same as the reports. She found her place on the page. That's the thing about doing the right thing correctly. There's not much to explain afterward. He picked up his jacket. You always were the most annoying kind of right." She almost smiled. He left. The board convened at 7 that morning. Claire wasn't invited, but attended anyway. Voss's team had made clear her presence fell within the Federal Review's scope, and Danielle needed someone who understood the clinical reasoning behind each intercepted report to explain it to people who weren't clinicians. Claire explained them for 45 minutes, answering every question directly, softening nothing. When a board member suggested some of the documentation had been ambiguous, she cited section and paragraph from memory. Memorized 14 months ago, because that was the kind of preparation that let you say exactly what needed saying the moment a room finally decided to listen. "What do you want from this process, Nurse Donovan?" the acting chair asked at the end. "A full external review of every mortality review from the past 3 years, independent of hospital administration. Every nurse who filed a concern interviewed without management present. Staffing thresholds reviewed by someone who understands what a 4-to-1 ratio does to a night shift." She paused. "And Bernard Jelinas' family told that what happened to him was preventable, and that this hospital is taking responsibility for it." The chair made a note. "That's not a want," Claire said. "That's what happened. The question is whether you document it correctly." Zoe Tremblay moved out of pediatric recovery 4 days later, into a regular room where the hospital's volunteer coordinator presented her with a stuffed bear. She named it herself with great care. Renee Tremblay walked into that room on day 6, slow, one hand on the rail, and the sound Zoe made at the sight of her was the sound of something long suspended finally landing safely. Claire heard about it from Tara, who'd been there to check Renee's wound and cried in the hallway after, unembarrassed. Arthur Benoit went home on day 5, chest tube out, discharge instructions read twice and folded carefully into his jacket pocket. He stopped at the nurse's station on his way out and asked for Claire by name. 40 years on the highway, he said, seen a lot of weather, never seen anything like last Tuesday. He offered his hand. "How are your ribs?" she asked. "Complaining," he said. "Better than the alternative, thank you." She shook his hand. He left. The provincial report, released 3 months later, named the failures plainly. Systematic triage manipulation, suppressed safety reports, 3 preventable deaths including Bernard Jelinas, inadequate staffing, a culture of administrative retaliation that had run at least 2 years under Gerald Marsh's direction. Marsh pled to regulatory charges. His medical administration license was revoked. The board chair resigned. Danielle was promoted to interim compliance director and immediately filed 6 things she'd been sitting on for 2 years. The Federal Health Authority used Harbour Cross as a case study in its national review of hospital accountability. It didn't name Claire. She'd asked that it not, calling her only the clinical staff member whose safety reports initiated the review and the nurse on duty during the critical incident. Tara called the report infuriating and accurate. Marcus printed it and pinned it in the break room. Dr. Lau folded it into the orientation he now ran for incoming residents every 4 months. 4 hours longer than it used to be, with a new session on what to do when you believe something is wrong and the correct channels are closed. He asked Claire to teach it. She said she'd need an hour. He told her to take 2. 6 months after the storm, Claire drove to work on a clear August morning, the harbor flat and blue, as if nothing difficult had ever happened on it. She clipped her badge to her scrubs in the car park. A new one, issued after the old, had gone through 1 wash too many, or nothing else. She'd thought briefly about asking them to add something. There were letters that could be added, a rank that no longer applied to her role, but had never stopped applying to how she did it. She'd decided against it. The badge said RN, that was what she was here, that was the work. She walked into the ER at 7:01 a.m. Tara was finishing handoff. Marcus was restocking Bay 2. The board already had 4 names on it. 2 observations, 1 procedure, 1 pending. Ordinary things. Lau looked up from a chart. Donovan. Morning. 2 ambulances inbound, 15 minutes. Cycling incident on the waterfront, 1 with head trauma, 1 with road rash and a radius fracture. She was already moving toward the board. Bay 1 gets the head trauma. Bay 2 gets the fracture unless vitals say otherwise. On it, Marcus said, heading for the trauma tray. Already on it, Tara said, already on the phone. The ER moved the way it had learned to move. Not under fear, not under a man who'd once confused power with permission, but under the shared attention that was only possible when everyone in the room trusted the work more than the hierarchy. Claire picked up the marker. Her eyes moved across the bays, the names, the clean empty spaces waiting to become somebody's worst night, and somebody else's reason to keep showing up. Outside, the harbor was still blue. Inside, the work was waiting. She wrote the first name on the board.